Hello.
Hello, Miss Malika. How you doing today?
I'm fine, thank you.
Oh man, I'm so glad you're in your office today because I don't know what is going on with me. My wife has been complaining about my snoring. I'm at work and I'm falling asleep, so I don't know what's going on. She suggested I come see you, so so just try to see what is going on with me.
Well, the chances is so interesting for you to come in and bring up that subject. I am doing a paper, and the topic of interest is sleep health. The reason why I'm interested in it is to increase the awareness of sleep apnea in the adults population.
Okay, so sleep apnea. I've never heard that before. Could you tell me why is that important?
It's important because we all need to get adequate sleep, and we also need to treat sleep disorders to help improve our health in the adult population. um, Improving our health, we live a longer life. But there are several disorders that come under the title of sleep health.
Okay,
And sleep apnea is one of those.
okay, all right. And you said something about health equity.
Yes, health equity basically says that everyone should be able to receive an opportunity to live a healthier life.
Okay.
But there are always things that can block that. And because we live in a population that may be affected by um, our social life, our economical life, our environmental condition, that can get in the way of treating health inequities.
Okay. So you saying something about health equity. Is there a certain group or certain certain number of people who can be affected by this health equity?
Well, I did a study, and I found out in the study, Dr. Lauren Hale, she did a video, and she talked about how the African American male are more at risk of having sleep apnea than the Caucasian. We found on an average that the African American male get less sleep than the Caucasian get,
Okay.
and so that causes us to have higher risk of having diabetes and heart disease.
Mm-hmm. Okay. All right. Let me see. So you're saying African American male, and that's me. I can be more affected by the sleep apnea thing. So, how can we improve the situation?
Well, we can improve it by educating the population. We can improve it by promoting um, sleep strategies that will help people sleep better at night. We also can start um, placing flyers in businesses and maybe healthcare offices and getting the consent of the owner to place them there to educate the public.
Okay.
We also can use what's in our hand. Mostly everyone now has a iPad, iPod. They also have, a phone.
Mm-hmm.
So some of those social media programs can be used to educate people about the risk of sleep apnea and make them aware that there is something that could cause them to have health disparity.
Okay. All right. So, what are some of your, so you've been doing your research paper, what are some of your key findings of sleep apnea, sleep health?
Well, I find something that's very interesting, and that is adults need 7 to 9 hours of sleep every night. Children need a minimum of 9 hours of sleep a night. If sleep disorders are left untended, they're going to have chronic illnesses, and that can lead to death.
Okay. All right. So, and Miss Malachi, nurse, how long have you been a nurse?
I'm sorry to say, but it's been more than 40 years.
No, no, sorry to say that's good. And how was sleep apnea? What was sleep apnea when you were a nurse, like when you first started?
Sleep apnea was somebody that was snoring, and we never did discuss it. It was not a health risk. We didn't think at the time,
Okay.
but as time has gone by, it is a problem.
Okay. So, what would you do differently um, now compared to then?
What I would do now is that I would have a discussion with my private provider. He does not do anything with sleep apnea. I am part of a rural health center, and I plan on talking to them about sleep apnea because they can give services for free or either for rate scale them to help them be evaluated for sleep apnea. I would print off material and give to patients to further educate them.
Okay. All right, Miss Malachi, thank you so much for your time. I will probably go and just follow up and see what I can do, learn some, see what's going on with this sleep apnea if I have this situation.
Amen.